Do you ever feel constantly tired, weaker during workouts, or less motivated than you used to be? Maybe your sex drive isn't the same, or you've noticed mood swings and brain fog creeping in. These aren't just random changes. They can be signs of low testosterone, a condition that's becoming more common in men of all ages. While testosterone naturally declines as we get older, lifestyle habits, stress, poor sleep, and even medical conditions can speed up that decline dramatically. The good news? Once you understand the causes, you can take action to protect your hormones, restore energy, and regain vitality. In this video, we'll uncover the most common causes of low testosterone and what you can do about them. Before we explore the common causes of low testosterone, it's important to understand why this hormone is so vital to a man's health. Testosterone is the primary male sex hormone, but its influence extends far beyond reproduction. It plays a central role in building and maintaining muscle mass, supporting bone density, regulating mood, fueling energy levels, and driving sexual health. In short, testosterone shapes much of what we associate with vitality, confidence, and masculinity. In healthy men, testosterone levels peak in early adulthood and then gradually decline, usually around 1% per year after the age of 30. While this natural decline is expected, many men experience drops that are faster and more severe than normal. This is when symptoms begin to show: chronic fatigue, reduced libido, weaker erections, muscle loss, weight gain, especially around the belly, mood swings, anxiety, and even depression. Low testosterone doesn't just affect quality of life in the present, it also poses long-term health risks. Men with persistently low levels are more likely to develop obesity, type 2 diabetes, metabolic syndrome, and cardiovascular disease. Bone health also suffers, increasing the risk of fractures and osteoporosis. That's why understanding testosterone isn't just about performance in the gym or bedroom, it's about protecting long-term health, independence, and confidence. Recognizing the importance of testosterone helps us see why habits like poor sleep, chronic stress, alcohol, smoking, and other factors are so dangerous. They don't just chip away at daily energy, they accelerate the hormonal decline that every man will eventually face. The good news is this: while testosterone naturally declines, many of the biggest causes of low T are preventable. By understanding what drains testosterone, men can take real steps to slow decline, protect their health, and reclaim vitality. Aging is the most natural and well-known cause of low testosterone. After about the age of 30, a man's testosterone levels decline by roughly 1% each year. On its own, this gradual drop is not always harmful, and many healthy men maintain vitality well into their 60s and 70s. However, poor health and lifestyle habits can accelerate the decline dramatically. Factors such as obesity, chronic stress, lack of exercise, poor sleep, smoking, and alcohol use can push testosterone far below the normal range for a man's age. This is why some men in their 40s already feel symptoms of low T, while others remain strong and energetic much later in life. Aging itself is inevitable, but how quickly testosterone falls is largely influenced by the daily choices you make. Obesity, especially excess belly fat, is one of the strongest lifestyle-related causes of low testosterone. Fat tissue contains an enzyme called aromatase, which converts testosterone into estrogen. The more belly fat a man carries, the more testosterone is lost through this conversion process, while estrogen levels rise, creating an unhealthy hormonal imbalance. This leads to muscle loss, lower libido, fatigue, and even mood changes. Obesity also increases inflammation and insulin resistance, both of which suppress testosterone production even further. Men with high body fat often experience a cycle. Low testosterone makes it harder to lose weight, and extra weight keeps testosterone levels low. The good news is that losing even 5 to 10% of body weight, especially around the waist, can significantly boost testosterone levels and restore energy, vitality, and confidence. Chronic stress is a silent but powerful enemy of testosterone. When you face ongoing stress from work, finances, or relationships, your body releases high amounts of cortisol, the stress hormone. Cortisol and testosterone work in opposition. When cortisol rises, testosterone falls. This happens because the body prioritizes survival over growth and reproduction. Elevated cortisol suppresses the hypothalamus-pituitary testes, HPTA axis, which is the hormonal pathway responsible for testosterone production. At the same time, stress increases belly fat and disrupts sleep, both of which lower testosterone further. Over time, men under constant stress may experience fatigue, reduced libido, mood swings, and muscle loss. All signs of low T. Learning to manage stress through sleep, exercise, meditation, or relaxation isn't just good for mental health. It's essential for protecting testosterone and long-term vitality. Sleep is one of the most important factors for healthy testosterone levels. The majority of daily testosterone is produced during deep and REM sleep, especially in the early morning hours. When men consistently sleep fewer than 6 hours per night, testosterone can drop to levels typically seen in men 10 to 15 years older. Poor sleep doesn't just cause fatigue, it disrupts the body's entire hormonal rhythm. Conditions like sleep apnea, late-night screen use, irregular schedules, or excessive caffeine all cut into restorative sleep and block testosterone release. The effects are clear. Men with poor sleep often feel drained, lose motivation, and struggle with libido or muscle growth. Improving sleep hygiene, going to bed at consistent times, creating a dark, quiet environment, and limiting stimulants can restore testosterone production quickly and naturally. Alcohol is another major factor that lowers testosterone, especially when consumed regularly. Inside the testes, testosterone is produced by specialized cells called Leydig cells. Alcohol directly damages these cells, reducing their ability to create testosterone. At the same time, alcohol increases the activity of an enzyme called aromatase, which converts testosterone into estrogen. The result is less testosterone and more estrogen, a double hit to hormonal balance. Alcohol also raises cortisol levels, further suppressing testosterone production through the HPTA axis. Even moderate drinking can cause a temporary drop in testosterone for up to 24 hours, while long-term heavy drinking is linked to infertility, erectile dysfunction, muscle loss, and low energy. Cutting back on alcohol or drinking in moderation gives your body the chance to recover and restore testosterone levels naturally. Smoking is one of the most harmful habits for testosterone and overall male health. Cigarettes contain thousands of chemicals, many of which cause oxidative stress, damaging the delicate Leydig cells in the testes that produce testosterone. Over time, this reduces the body's ability to maintain healthy hormone levels. Smoking also damages blood vessels, restricting circulation that is essential for both hormone delivery and erectile function. This double impact not only lowers testosterone, but also contributes to erectile dysfunction, infertility, and reduced vitality. In addition, nicotine disrupts the hormonal signaling between the brain and testes, further decreasing testosterone production. Studies consistently show that smokers have significantly lower testosterone compared to non-smokers. The good news, quitting smoking can quickly improve hormone balance, restore energy, and protect sexual health. A sedentary lifestyle is one of the clearest modern causes of low testosterone. The male body is designed to respond to physical challenge when you lift weights, sprint, or perform intense exercise. Your body releases testosterone to repair muscles and build strength. But when you spend most of the day sitting, this natural stimulus is lost. A lack of resistance training and daily movement leads to weaker muscles, more body fat, and declining hormone levels. Even worse, prolonged sitting is linked to insulin resistance and metabolic problems that further lower testosterone. Men who live sedentary lifestyles often feel tired, gain belly fat, and lose motivation. The good news is that adding regular resistance training, short bursts of high-intensity exercise, and even simple daily activities like walking can quickly trigger testosterone release and improve overall vitality. Chronic illnesses such as diabetes, heart disease, and metabolic syndrome are strongly linked to low testosterone. High blood sugar levels in diabetes damage both blood vessels and the Leydig cells in the testes, reducing hormone production. Heart disease and poor circulation further impair the delivery of testosterone throughout the body, leading to reduced sexual performance and lower vitality. Metabolic syndrome, characterized by belly fat, high blood pressure, high cholesterol, and insulin resistance, creates a hormonal environment where cortisol is high and testosterone is suppressed. These conditions also increase inflammation, which interferes with hormone signaling along the HPTA axis. Men with chronic illness often experience fatigue, reduced libido, and muscle loss as part of this hormonal imbalance. Treating the underlying disease, improving diet, and adopting active lifestyle habits can significantly improve testosterone levels and overall quality of life. Not all cases of low testosterone are caused by lifestyle. Sometimes the root lies in hormonal disorders. The hypothalamus and pituitary gland in the brain control testosterone production by signaling the testes through luteinizing hormone LH. If these glands are damaged or not functioning properly, testosterone levels drop even if the testes are healthy. Conditions such as pituitary tumors, hypogonadism, or thyroid imbalances can disrupt this communication, leading to chronically low T. For example, an underactive thyroid slows metabolism and reduces the body's ability to maintain normal hormone balance. Men with hormonal disorders often experience severe symptoms, including extreme fatigue, infertility, and depression, even at a younger age. Unlike lifestyle causes, these disorders usually require medical testing and targeted treatments, such as hormone replacement therapy or surgery. Early diagnosis is key to preventing long-term complications. Certain medications are well known to suppress testosterone, either by interfering with production in the testes or by disrupting the hormonal signals from the brain. Long-term use of opioid painkillers can significantly reduce testosterone by suppressing the hypothalamus-pituitary-testes HPTA axis. Anabolic steroids, often misused for muscle growth, can shut down the body's natural testosterone production because the brain senses excess hormones and stops signaling the testes. Chemotherapy and radiation treatments, while life-saving for cancer patients, can also damage Leydig cells and reduce hormone output. Even some common drugs like antidepressants or blood pressure medications may lower testosterone as a side effect. Men experiencing fatigue, low libido, or other low T symptoms while on medication should consult their doctor. Adjusting the dose, switching to alternatives, or adding hormone therapy may help restore balance. Testosterone production relies on certain key nutrients, and deficiencies can quickly lead to hormonal imbalances. Zinc is essential for the function of enzymes that drive testosterone synthesis. Without it, testosterone levels fall and sperm quality declines. Vitamin D, often called the sunshine vitamin, acts more like a hormone and is directly linked to healthy testosterone levels. Men with low vitamin D almost always have lower testosterone. Magnesium supports energy metabolism and helps regulate hormonal balance. Diets low in these nutrients, often due to processed foods, lack of sunlight, or poor absorption, make it harder for the body to produce testosterone. Symptoms of deficiency include fatigue, muscle weakness, and reduced libido. The good news is that restoring these nutrients through whole foods like oysters, eggs, leafy greens, nuts, and fatty fish, or with supplements if needed, can naturally improve testosterone levels and overall vitality. Injuries or surgeries involving the testes are another direct cause of low testosterone. Since the testes are the primary site of testosterone production, any trauma, whether from accidents, sports injuries, or medical procedures, can damage the delicate Leydig cells and permanently reduce hormone output. Surgeries for testicular cancer or conditions like torsion may also require partial or full removal of a testicle, lowering the body's capacity to produce testosterone. Radiation and chemotherapy, while essential for treating cancer, can further harm testicular tissue and disrupt the hormonal balance controlled by the hypothalamus-pituitary-testes HPTA axis. Men who have undergone these treatments often report fatigue, reduced libido, and muscle loss as part of low T. In such cases, medical monitoring and possible hormone replacement therapy are critical to help restore balance and maintain long-term health and vitality. Now that we've covered the common causes of low testosterone, let's talk about the warning signs and when it's time to seek help. The tricky part is that symptoms of low testosterone often appear gradually and can be mistaken for normal aging or stress. But if you know what to look for, the patterns become clear. The most common warning sign is persistent fatigue. If you wake up tired even after a full night's sleep or if your energy crashes throughout the day, low testosterone may be the cause. Reduced libido and sexual performance are also major red flags, since testosterone directly fuels desire and erections. Other signs include muscle loss, increased belly fat, mood swings, irritability, and brain fog that makes it hard to focus. If these symptoms last for months despite improving sleep, exercise, and diet, it's time to consult a doctor. A simple blood test can measure testosterone levels and uncover whether the problem is age-related, lifestyle-driven, or due to medical conditions like diabetes or thyroid issues. Early testing is important because low testosterone is not just about energy or sex drive. It's also a warning sign of deeper health risks like heart disease, osteoporosis, or metabolic syndrome. Don't ignore the signals your body is sending. Recognizing the symptoms early gives you the chance to take action, get the right diagnosis, and start protecting your long-term health and vitality. The good news is that many causes of low testosterone can be prevented or reversed. Prioritize quality sleep, manage stress, maintain a healthy weight, exercise regularly, and fuel your body with nutrient-rich foods. Limit alcohol, quit smoking, and stay proactive with regular checkups. If symptoms persist, consult a doctor for proper testing and treatment options. Protecting testosterone means protecting your energy, confidence, and future health. If you found this video helpful, please like, subscribe, and hit the notification bell. Don't forget to share. Someone you know might need this today.